Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with a blocked right ear. They were experiencing excruciating pain in this ear, which actually led them to visit the local hospital because they weren't sure of the cause. They were worried that they had an ear infection. And when they went to the hospital, they were advised that they've got occluding earwax. The patient had been using Q-tips, what we call in the UK cotton buds. Now, this patient was actually from America, and they were visiting family in the UK when they developed these symptoms. They're actually a nurse, or should I say, a soon-to-be nurse. I think they're in their final year, and they were just explaining to me how earwax was removed in the States, which I'm quite familiar with now, as I've read obviously a lot of comments from the past, and they were quite amazed to see the technology that we were using here. They've never come across this in America, and they were explaining that in America the norm still is to syringe. So syringe is a method to use to remove earwax, and it involves a metal syringe typically, and that's full of water, and it's pumped into the ear, the water via the metal syringe, in the hope of flushing the wax out. So the concept is the water enters the ear, it bounces off the eardrum, and as the water comes back out of the ear canal, it takes with it and flushes out any earwax. So in the UK, ear syringing is actually banned. So you won't see, only place you'll see a metal syringe for earwax in the UK is in an old-fashioned museum. That doesn't mean that earwax in the UK still isn't removed by means of water, and what I mean by that is the syringe has been replaced by something more less invasive. It's called an Irrigator. I think that's become more widespread around the globe as well, but it's where the specialist can control the flow of water by the different settings. So some of these irrigation machines come with foot pedals, so the further you put your foot down, the more flow of water is introduced into your ear. So for that reason, it's a bit safer, but in essence, any procedure that's going to use water always carries increased risks of developing an ear infection, so known as swimmer's ear. And that's because water, believe it or not, is bad for your ears. We want to try and avoid water entering the ears in the first place. Because of the water pressure, even if it's controlled, there's always the risk of perforating the eardrum with excess pressure. Sometimes it can push the wax further in. Patients who have suffered from recent ear infections or ear surgery, or have got ventilation tubes or active perforations, or perforations in general, any hole in the eardrum, they can't undergo any procedure that involves water, because if that water enters the middle ear space behind the perforation or the hole, it can lead to a middle ear infection. So in the UK, the gold standard method of removing earwax is by using suction, microsuction, which is what we're doing here, and also dry instruments, ear hooks, Jobson horns, earache, forceps. And that's the norm, I would say, in the UK now. So slowly but surely, irrigation is being superseded, and although I do know quite a few specialists that still use it, but it's not regarded as the go-to method anymore. It's not the primary method of earwax removal. So we're hoping other parts of the world are also following suit, and that's just because it's a high incidence rate of contraindications and side effects of using water to remove earwax. I think the stats are around 5% of patients either develop a perforated eardrum or an ear infection by undergoing ear irrigation or having wax removed by introducing water into the ear. So whereas the incidence rate of microsuction and other procedures are far, far less, I'd say less than 1%. It's not to say that performing microsuction and removing wax with dry manual instruments is completely risk-free. There is a risk with any type of procedure, but far less, hence why in the UK, microsuction and dry removal of earwax is regarded as the gold standard. So we're not going to remove every little last speck of wax. The patient had been using hydrogen peroxide drops, and what that does, it changes the consistency of the wax. It converts it into more like a thick mud consistency. Is the best analogy I can give. So you're going to get staining, you're going to get patches of wax here and there, and that's all fine. A bit of wax is good for us. The main idea is to clear the ear canal so the eardrum is visible. Even if I left this residual amount of dead skin on the eardrum, it wouldn't have caused that much of an issue for the patient, but they were quite still and felt quite confident removing it off the eardrum for them, so I just continued. So we advised the patient, of course, not to use any cotton buds, and also to avoid water in the ear, because I did also mention getting water in the ear. And if they are going to use drops in the future, to avoid hydrogen peroxide drops, I recommend medical grade olive oil. In fact, if you're in the UK, you can purchase some Clear branded medical grade olive oil spray, which I'm a healthcare advisor to the company called Clear, and the link's in the description. Whilst you're just watching me finish this remaining procedure, so just removing some of the excess olive oil now that I used to soften this wax, I just want to update people, namely any specialists who are watching the channel, on the launch of our Waxscope, and we're delighted to say that we're hoping it's going to be launched by the end of the month, all going well. We should know later this week with a definite date, but all looking well. So the Waxscope is our latest device. If no one's seen videos taken with the Waxscope, there's a link in the description where you can follow to watch. I've got another YouTube channel where we upload videos using the Waxscope. It's a completely different view, different concept to the endoscope. So this is the iClearScope endoscope, which we launched back in 2015. The Waxscope is not designed to compete with the endoscope. The endoscope for me is the number one method of removing earwax. However, using an endoscope can be very, very difficult and challenging. It requires a high skill level. And over the years, a lot of specialists who've come on our training courses really do struggle to use an endoscope. And the main reason for that is when you're using an endoscope, you're having to use both hands simultaneously. One hand to hold the endoscope and maneuver it in the ear to stretch and widen it, and the other hand to remove the earwax. So it requires a lot of bilateral integration. So with the Waxscope, we've attached a speculum to stretch and widen the ear for the specialist to make that easier. The view is more like an ENT operating microscope, so it's not like an endoscope, but it is easier to hold and use. And for me, if someone's not able to use the iClearScope endoscope, the next best device on the market is the Waxscope. So we're hopefully going to launch that shortly. Do take care, guys, and speak soon. Bye.